everyone, we're the team at Precision Brain Center, and June is Migraine and Headache Awareness Month, so we just want to share some educational insights and tips on how to manage migraines and headaches. So, Dr. Cabela, what is the difference between a migraine and a headache?
It's a very good question, and it's a complicated answer. So, in the most simplistic way, we think of migraines traditionally as a neurological disorder, and the reason being is it's accompanied by a lot of neurological symptoms, and we know that there's changes in the brain that correlate with a high firing rate, like almost like epileptic seizures. And so that's where it transitioned into the category of neurological disorders. But I want to say that, and also say that we see tons of headaches that are symptomatology of things going wrong in the brain, right? So post-concussion syndrome can present with post-traumatic headaches that are really debilitating, and that can accompany neurological symptoms as well, including dizziness and nausea and things like that. So traditionally, when we're talking about migraines, we are thinking about the presentation. And what's so interesting about migraines is that sometimes people don't even have pain. Okay, so we have different vestibular migraines, we have optic migraines, and then we have your traditional migraines. But there's these array of symptoms, including nausea, sensitivity to light, the aura, where you see lights flashing, things like that. So it's a thing that is affecting so many people. So that's why we're kind of wanting to share some educational resources, do our best to just interpret some of the heavy science so that it's digestible to help people understand what's going on in their brain, and then maybe some tips here and there to help alleviate the pain symptoms at home. Okay, just continuing on with that headache and migraine topic, I have a couple questions for Dr. Blake so she can kind of explain. We know that there's a lot of confusion around migraines and headaches, and it's hard to differentiate and things like that. So Dr. Blake, can you help explain what are some of the similarities, and then what are some of the difference, and why maybe there is some confusion between the two?
Yeah, definitely. There can be a lot of confusion on types of headaches, and if you are experiencing a migraine versus a headache under primary or secondary. So we can start there with primary versus secondary. So primary means that there is nothing causing the headache. There's no underlying condition that is causing it. Secondary means that's something like a dehydration headache. So the lack of water intake could be causing the headache, or something metabolic. So during your menstrual cycle, people may experience headaches. Going off of that, so migraines, they can be unilateral, throbbing, pulsating, and they can focus behind the eyes. And a lot of times people may think, oh, this is the worst headache I've had in my life, it's got to be a migraine. That's not always the case. So not every headache is created equal. Actually, cluster headaches are sometimes argued by neurologists as one of the most painful headaches. So these occur behind the eye. You'll see people have a runny nose, watery eyes. So it can be a common misconception that just because you're having a really bad headache, it has to be a migraine. That's not always the case.
To tie this all together, and why there is this commonality between headaches and migraines, and then there's also the differences, is to remember what areas of the brain experience pain, and also how pain occurs in migraines or headaches. So a cool thing to note is our brain actually does not have nociceptive fibers or nociceptive receptors, so it does not feel pain. However, the nociceptive receptors are lining our blood vessels. So if you take a look here and you see this beautiful red outline, it shows blood vessels, right? So the blood vessels have nociceptive fibers. Also, the outer layer that keeps the brain nice and secure, because the brain is like a jello, gooey substance. It's not a solid material. And it's held together with this pia and dura matter. They have nociceptive receptors in it. So that's what experiences pain. One of the things that triggers a nociceptive receptor to fire and send a pain signal is going to be changes within the diameter of a blood vessel. So when we get what's called vasospasm, so abruptly our blood vessels constrict and dilate, and so they'll trigger that. Why they trigger that? Well, let's think. What is one of the most important things for the brain and for neurons? It's to get proper blood flow. Like if we can't get proper blood flow to neurons, they die. So it's an emergency situation, and we need to feel pain because something's going wrong. So when we're talking about both migraines and headaches, or their underlying physiology is going to be the same. It's going to be that nociceptive fiber relating to blood flow, vasoconstriction, things like that. So we're also going to share some cool tips that are helpful for people at home. Now, everybody has a different brain, different baseline, and also the reason they're having headaches or migraines is going to be vastly different based on their individual brain function, okay? So things are going to work differently in one person compared to the other. So we're going to give you some tips so that you can try out at home to kind of figure out what's going on with your nervous system, specifically the autonomic nervous system. As a refresher, that's going to be the combination of our sympathetic and parasympathetic nervous system. They do very different things. Some areas are going to dilate our blood vessels, some areas they're going to constrict our blood vessels, and they work together in tangent. Both systems are super important and need to be balanced. A lot of people like to think that the sympathetic nervous system is a bad guy, but it's so important and has some beautiful, wonderful jobs that we need and that allow us to thrive as human beings. So just real quick, Dr. Blake is going to help show this for people at home. So we have a couple areas that will change our autonomic nervous system and change the response. And the way we can do it is with temperature changes, because we know temperature, hot and cold, it's going to have a constriction effect and then a dilation effect with hot. One person may need more constriction, one person may need more dilation within their blood vessels controlled by the autonomic nervous system. So 3 locations that we can use to test this out. One is right on the forehead. The next one is going to be over the carotid arteries in the front of the neck, and the next one is going to be at the base of the skull in the back. So Dr. Blake is going to go ahead and show you. We're going to start with the forehead. So this is an ice pack, so you're going to want to, you can pick hot or cold. If you're somebody who takes cold showers and you feel better, your headache feels better, start with cold. If you take hot showers and your headache feels better, start with hot. But each location will have a different consequence centrally in the brain, so it's worth trying them all out. So you're going to at least start with 5 minutes. Forehead, then carotid, right here. Yep, nice and gentle, nothing crazy cold. And in this 5-minute period at each location, you're going to say, is it making it better, worse, or same? So if it's worse or same, stop doing it and move on to the next location. Last location is at the base of the skull here. And put it on your skin too, so you actually get the temperature changes right up here, at least 5 minutes. So then after the cold sequence, then you would do the same thing and just try warm at each place. And you're saying, is it better, same, or worse? So then you'll kind of know. And there should be at least one that makes a difference for you and your headaches. The other thing that's cool is like capsaicin. Capsaicin has an awesome, it's hot. Like if you like spicy foods, you can go eat spicy food. It's going to help your headache because it actually has a dampening effect on our nociceptive fibers. Yeah, so just little things. Another thing that's worth noting, some people have headaches and migraines because of magnesium deficiency. So easy, you can get it at like Walgreens, things like that. You can get any form of magnesium and start taking it and see if it's helping your headaches. Take it at nighttime, it should help with sleep as well, so that's something to try. Dr. Blake mentioned earlier, water is huge, electrolyte balance is huge, because when we're talking about autonomic nervous system, blood vessels, we're also involving what is our heart rate, what is our blood pressure. How hydrated you are and how concentrated your blood is with electrolytes is super important for blood pressure and heart rate consequences, because it changes vascular peripheral resistance, right? So check to see if you're hydrated well enough. Maybe you're not getting enough salt. I know everybody likes to vilify salt, but it has a very important role in our body. Yep, and I think that's it. Any other questions?
How long can a migraine last? And is there a certain point where someone should be concerned and maybe seek extra medical attention?
Yeah, so, you know, we're all very different and sometimes we don't have access to medical care. I do want to leave this conversation letting people know migraines are very serious because at times they resemble epileptic seizures because we get this spontaneous firing rate. The reason being is we lose blood supply. So you're getting a little ischemia in these areas. When neurons lose blood supply, they start spontaneously firing. So yeah, especially if it's a new migraine, new onset of headaches, you always want to go see your primary care. It's the first place to start. Next place, if you're worried about something acute, emergency types of situation, you want to go see a neurologist, you want to go to the ER, things like that. we're on the end of things where maybe you're not responding to medication and your migraines are getting worse, things like that, it's totally worth checking out functional neurology. But first thing is making sure you're safe and there's nothing going on in terms of an emergency. So definitely, yep, the sooner the better. And the length of migraines can be very different for many people. Sometimes it escalates, right? So initially they may start and there's about 24 hours, and the longer somebody's had migraines, like let's say it's been going on for 5 years, they could be out for days to weeks. Like it's really, really bad because it does a massive impact on your nervous system.
Thanks for joining us today. We're super passionate about sharing education. We know that there's a lot of misinformation out there. So any questions you guys may have, please feel free to reach out.